Thank you all for joining us today. We really appreciate your time this afternoon. I'm sure many of you have been on, this is probably not your first Zoom or virtual meeting of the day. So we really appreciate your time.
Absolutely. And we'll keep your time precious and make sure that we start and stop on time. So welcome again. So here we are. And so who are we? Nicole?
Yeah, so I'm Nicole Augustine. I'm actually the founder of Rise Consultants, which was a business I just started probably about 5 years ago, focused on strategic planning, working with prevention, and assistance. So I'm excited to be on the call this morning and to be, well, this afternoon and talking with you all today.
Yeah, and I'm Dr. Wanda Boone. I've been in the field of prevention for 30 years, which I still cannot believe. Our motto in building resilient communities until we're here, until every community thrives. And prevention is something that's near and dear to my heart, and I'm committed to it. So I'm happy to be here with you.
So during our time together, there's a couple things we wanted to kind of talk about. Actually, for probably a lot of the conversation, it'll be coming from Dr. Boone. We'll start with a conversation about coalitions and our purpose and really thinking about the role of coalitions in prevention and the work that we do in the community. And then this recognition that for most of us, life has changed dramatically because of COVID-19 and social distancing and stay-at-home ordinances. And so really trying to have a conversation about what that means for our coalition work. And one of the things I'm really excited about is Wanda's going to showcase some of the ways that her coalition has created adaptations, one in how they communicate and build their relationships with their community partners, and two, the work that they're doing in the midst of COVID, because prevention still can happen, even though some people might be wondering how. So we're very, very excited to have this webinar and be talking with you all this afternoon.
So the purpose, as Nicole mentioned, here we are as coalitions, coalition facilitators, coalition members, people that are interested in prevention. And for me, our coalition, Together for Resilient Youth, been around for almost 20 years. It's so hard to believe that time has gone by that quickly. But in those 20 years, I think that we as a coalition have learned just a couple of things. And so I wanted to share some of those things with you, not to think that you don't have this same information, but I think it's really important for us to look at our coalitions in a fresh way, especially because of COVID-19. So if you would put your phones on mute, that would be great. So we are not bean counters. We don't meet to meet, and we are not sector member number counters. So some of that may be really familiar to you. I think that many times in prevention, and what I mean by being counters, I should have called it people counters, because how many people do you have in the room? What are the demographics of the people that you have in the room? But I don't think that coalitions are appreciated for the powerful movers and shakers that we are in prevention, and then expanded to the state that we're in now with COVID-19. So we know who we're not, and we need to do a better job of explaining that and talking about that to other people. Because if we don't recognize our own worth, our own value, then how are we going to communicate that to anyone else? And we do have strategies, and we are evaluated, and we do show changes in data. but somehow, some way, that message may not be getting out in the way that we want it to. So we are champions of change. We are social norm and landscape movers. So changing the landscapes of communities as far as substance use, suicide prevention, and some of the other things that we are preventing. And then the other thing that we are expert in, or can become more expert in, has to do with preparing for the future and whatever comes down the pike, whether it's a new drug or a change in the way that substances are used, a change in the data that we see, any of those kinds of things, we can mobilize very quickly our coalitions in terms of preparing for and helping people in that regard. Now, I saw the chat room kind of moving along. Is there something that we need to pay attention to?
No, I just asked for, I heard Florida, and it occurred to me to have people just drop in the chat where they're from.
Great, okay. I just wanted to make sure that I wasn't missing something.
You're good. You're totally good.
Okay, and we do have a phone that is not on mute, and I can hear like some rustling of papers and things. So if you could put your phones on mute, that would be great. So coalitions can achieve more widespread reach within a community than just one single organization. So that's part of our worth and benefit as well. We have sector representatives who reach their spheres of influence, who reach their spheres of influence, and we need to do a better job of monitoring and looking at that change. And the other thing is that we can also advocate for policy change as this machine that we have developed. We do not lobby. No, 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 we don't lobby. But we do impact policy. We can impact policy, and we can be advocates that help people understand what certain activities, things that are going on in the environment. We can look at things like alcohol outlet density, things like that, where other people may not be thinking about that in the same way. And so we bring that to the table and to the discussion as well. Coalitions provide a forum for distributing information, education. Now that's probably the simplest part of our job, is to provide information. I don't discount that, but we know that policy change can give us the biggest buck. But the other thing is not to discount the distribution of information, which becomes particularly important during this time of coronavirus. Coalitions can foster personal satisfaction and help other coalition members understand that what they do really has an impact. How many times have we heard, if we've heard, that people may come to a meeting, or you just may hear, well, I don't know that what I have to offer is anything that will really make any difference. Well, we who kind of observe things in a different public health kind of way can almost see where a person fits in. But we ask the question, we ask the question, what do you like to do? What do you enjoy? And then from there, they can and we can develop that relationship. Coalitions can conserve resources, which is really important right now. If we're concerned about how to use our grant funds, or what we were doing as a separate but larger entity before, how can we benefit others and how can others benefit us? And then we all have more resources than we would alone. And lastly, Coalitions can foster cooperation between grassroots organizations, community members, and diverse sectors of the community, and be the bridge, if you will, with larger entities, with institutions and agencies. I think perhaps in this day and age, that is one of the single most important aspects of coalitions. So not only do we build consensus among organizations, we build trust. We are people that can be trusted with the hearts, lives, and minds of the community. And therefore, we can bring forward ideas and solutions that work for different socioeconomic groups as well. So, in a nutshell, that's who you should see yourselves as. That is your value. And you are so necessary and important, not only during this time of coronavirus, but ongoing. But I want us to continue to discuss what's so important to have happen within and without our coalitions at this time. Nicole?
Sorry, I was mute, sorry. I was like, hello. And actually, in reflecting and hearing you kind of talk about the purpose of coalitions, I would be interested if anyone is, sometimes folks are shy on webinars, but we're all friends here. If folks would even be willing, if anyone feels inspired to even just share for themselves, how has even all of this, everything that's happening right now in our society, had you thinking about the purpose of coalitions and the work we do in our communities? And I'm just wondering if anyone has any reflections on even this first piece that Wanda's talking about.
Don't be shy. They're shy.
I know, right?
I'll check the chat box just in case.
And if anybody is talking, everyone's on mute. So, it says repeat the question. So my question is, one of the things we started talking about is the purpose of coalitions. And I'm wondering, with everything that's been happening, with how we operate changing, with social distancing, people having to stay home or work from home, have you been thinking about the purpose of coalitions and the work we do, and what is the purpose of a coalition? And I just wonder if this context has had you thinking about that definition at all. And it's okay if you guys are shy. The reason I think about this question, because I know, or was someone saying something? I don't want to cut someone off.
I see a phone that looks like it's unmuted, but I don't hear anyone saying anything.
Okay, and it looks like someone.
Wait, there we go. Courtney.
Okay. Hey, Wanda.
Hey.
Hey, I know we usually see each other at Putty, and so it's great to see you here. And I'll just chime in. Maybe I think for us as a coalition, it's in a way afforded us the opportunity to really diversify how we are providing information. We're very hands-on as a coalition, so there's a lot of times we're out in the community doing different things, but we didn't have a really strong social media presence or a diversified way of reaching a broader part of the community. So I'll say for us, our purpose in a way, really kind of dug into that a little deeper, and we got a little braver about things that we're trying out as far as connecting with community.
Thank you for sharing that, Michelle. I know that's what I've been hearing across the board with folks being limited and being able to interact directly, so much of the work we do is interacting directly with folks. And with all of that being changed, purpose and adapting during COVID-19 is a really, really important conversation. I love, Michelle, that you share that you're exercising and stretching a new muscle, right? Because I do believe in general, the prevention field is afraid of social media. And for most of us, that may be exactly the main thing that you're using a lot to engage with your youth, engage with sectors, engage with the community. So this is I would say this is definitely a learning period, a learning time, but I think it also is helping us create new skills that will continue to be used in the future. Did anyone else have a thought or comment? Okay. Okay. Well, I'd like for Wanda, one of the things that we started to talk about is even some adapting how we do prevention, but also adapting how we connect with our stakeholders. And so I would love, Wanda, if you can share with the group and talk a little bit about, you know, the innovations that your coalition's doing to, one, connect with your community stakeholders, being that you can't do it in person anymore, at least not for now. And even for us with states that have opened up, some of us, let's be honest, are not interested in doing stuff in person just yet, and that's okay. And so we want to talk about what are some of the ways that specifically Wanda's coalition is creating adaptations during COVID-19 that can continue past that time.
So I think one of the most important things that we do as coalition leaders and coalition members has to do with relationships. And those relationships need to be encouraged, they need to be fostered, they need to be understood. And I think that across the board, sometimes we forget that we live within our own bubble. We live within our prevention bubbles. We live within our home bubbles. And it's so interesting to me because the first thing that happens to me when I get on a Zoom call is that someone looks at the print behind me, which is one of my favorite prints that I've had since 1975. But and so they say, "Oh, I always wanted to see what your house looked like." Well, I'm sorry. And so we live within our own bubbles, our own environments, the people that we are used to being around, the tools that we're accustomed to using, the strategies that we find most effective. And until we learn how to operate in a more holistic and worldview, I will say, the harder it is for us to adapt. So starting with relationships first. So who do I have within my coalition nest that I can draw on, who may have the skills, the talent, the abilities, the desire, the time, because you know that even though we are here in our homes, sequestered, those of us who are still in this way, it doesn't mean that we're not busy. We may be busier, quite frankly, than we ever have been before, because everybody thinks you're home. So what else do you have to do except to be on another 3-hour Zoom call? But no. And so we have to, first of all, learn how to operate in this new way of being. So I think that one of the first things that we thought about had to do with the information that we're hearing on the news about COVID-19. And just as in the past, you heard about Juul, the electronic tobacco device. You then started thinking about, well, what can I do about Juul? how can I get this information out to different sectors, the business sector, parents, youth. And then you started looking at data, you started thinking about how this could be evaluated, you started looking about how members of your team could be involved in that. And it's the same thing in my mind in this time. So thinking about who needs what and why it's so important. And you've heard on the news that minority populations are more impacted, that older people are more impacted. And so we started looking at that and developing tools and ideas and social media posts and boosting those. And not only about COVID-19, but we also understand that substance use goes up during times of stress. And so you can put that into the messages that you develop for your community. And so, but the very first thing, before we even think about strategies and what we're going to do, we need to find out how our coalition members are doing. Are you okay? Do you need anything? Because the mental health and stress level of those that we work so closely with is really important. So we have weekly calls that only last for 30 minutes where we get to just check in to see how we're doing, to see how we're feeling. And it's not mandatory. So if someone doesn't want to participate, they don't have to. But thinking more on the human level before we start thinking on the process level. And I'll share a little bit more a little bit later.
Okay, I just want, if I could just jump in real quick here, because I think this conversation of self-care that you're talking about is so important. And the fact that you've actually embedded it into the process of your coalition. I think the one thing that's been unique about this whole coronavirus COVID-19 situation is that it affects all of us. Look at everybody. We're at home. I mean, you can't avoid the elephant in the room. Every conference call, everything, we are all being affected by what's happened society-wise. And so I always feel it's a little bit short-sighted when we come into our meetings and go straight to, let's talk about what we need to get done and our grant requirement and this, and have you done this report? When it's like, ooh, let's take a breath. We're all working from home. People are trying to figure out kids at the same time and all other types of stuff. And maybe you never had office space at your house, and maybe you have other people working at home too. It's a lot, you know? And so I really appreciate the process of actually just having an open-ended, if you're free and you need to debrief, let's talk, let's commune together, because that's a part of relationship building, which we all know is the core of a great coalition. It's the core of connecting with your community too. I would say, just like how Wanda's mentioning, they as a coalition provide this space to offer self-care. We mentioned social media earlier. There's no reason why you all can't do the same thing on your social media platforms. Offer an open space to just have people commune and say how they're doing, being that you're not reaching folks in the same way that you have previously. So thank you for sharing that. I just wanted to
Yeah.
add on that a bit.
Thank you. The other thing that we need to think about are those people that don't have access to the internet. And since I told you I've been in prevention for 30 years, it doesn't mean that telephones weren't invented, that we didn't have. I mean, we might have had rotary phones, but we had phones. So one of the things that we established a long time ago, and this is particularly useful with folks that are older, we had telephone trees, you know, where someone in the community had the list of people that they would contact over the phone. because that was the way to communicate. And so those telephone trees have become really useful. And so one of the things that you can do, especially if you are have a focus on low wealth communities, and again, if you didn't think about this before, then this is another opportunity to give some innovative thoughts. Um, and maybe we won't get into implementation today, but at least we will start provoking these thoughts and then we can pursue them further. But so we have individuals, coalition members, who still have their telephone trees. And these are people who like to talk on the phone, who use the phone more so than we would, because we use Zoom and the internet and Facebook and all those things. But they can say what's on a social media post in the same way that we see the social media post. And so that's what we're talking about in terms of adapting during this time. And it may be just a little bit easier to have this kind of communication with people offline than it was when we were able to be with everybody in the room. There's a different dynamic that happens. And, I'm not saying whether it's good or bad in terms of Zoom meetings. I mean, I'm excited to see people. There's a different dynamic about seeing people in Zoom than it is face to face. And some of that is really good. And we have to draw people out just like we have to during coalition meetings and say, well, Courtney, do you have a thought? I just said Courtney because she's the first name that I see. But, and draw people into the conversation so that everybody will be a little bit more comfortable with each other. So that's another way that we can adapt. Oh, go ahead, Nicole.
I actually was just going to make one comment about the very last thing that you mentioned,
Yes.
because, for me, one of the things that's been interesting is that we all got put into this virtual platform without any true guidance on how to do it. And I think, Wanda, you make a great point that the dynamics in a virtual room are completely different. Most people are predominantly quiet. When you ask a question, there's silence. Because it's awkward. It's not the same thing as when we're sitting around a table where there's a bit more back and forth. So even how we operate is shifting. Think about it. If you're choosing Zoom to do your coalition meetings, probably how your coalition meetings are running has morphed and changed a bit. And so these are like all the different various things that are affecting how we operate, I think are good conversations to have and things to think about.
Mm-hmm. So as we continue to think about prevention in this changing landscape, I would like to, if you feel comfortable in saying so, and I guess I'll be the first one, so I'll start with a comment, is what makes you most uncomfortable about your collaborative, your prevention experience during this time? So what are you most concerned about? What are you anxious about? What are your unknowns? And have you thought about what to do about them? So that's kind of long. So what are your concerns? Have you thought about what to do about them? So I would say that one of the things that we are tasked to do has to do with surveys and getting data, perception of risk data from students in middle school and high school in order to identify the perception of risk. So, and many of you know about this, so I'll just throw a couple out there. So how many of you high school students, middle school students used alcohol in the last 30 days, tobacco, Juul, prescription drugs, marijuana last 30 days. And then perception of risk has to do with how risky do you think it is for you to use, how risky you think your friends think, what do your parents think, you know, so those questions are a part of our grant requirements. And some of us have found ways to obtain that information from public schools, some with community members, but here we are, you know, schools are closed. And so that is a question that I have. So before I say, you know, anything more about that, I want to hear from you.
We did have, is it Enchante? Mentioned that her concern is re-engagement post COVID-19, her anxiety.
Yeah, and so I'm hoping that the little bit that I said about connecting with people by phone or email, you know, so the means of communication that you have. So it's almost like you use what you have, you know, hi, you know, so you can get on the phone, and the first thing that you say is, you know, you're a valued member of the coalition. Thank you so much for your participation. I just wanted to call and see how you're doing. Is there anything that you need? Now, if somebody says what they need, then 211 is one of the first ways that you can get into, 211, I don't know if that's national. I did see 211 mentioned in another state, but 211 is our deposit box for anything and everything that someone needs in the community, whether it has to do with health, homes, food, electricity, water, those kinds of things. And so, you know, so that's one way. And if you don't know off the top of your head, then let me see if I can find out for you. Then you can call the health department and then connect them. So that's one way that you can stay connected, but showing that you care really is job number one.
Anyone else wanting to share, willing to share?
I think they can help us.
I know that something that I've been hearing from, you know, folks in the field is concerns about as things reopen and, you know, when schools reopen, community centers, what does that mean for engaging those audiences and for prevention providers feeling comfortable, you know, doing the work in community centers, churches, that sort of thing, in the more traditional way that we did it before. Because the truth is, in all of this process, a lot of fear has been placed into people around human interaction. That's where we are, unfortunately, right now. And so I know I'm hearing anxieties. This is like re-engagement post COVID-19. Once everything's open, you know, even us as the, you know, coalition members, comfort with providing our in-person services. That's what I've been hearing.
Mm-hmm. And so we have people on the line who are from different states. And so I'd like to hear from you in terms of the plans for your states or your counties, communities, in terms of opening up. Where are you in terms of thinking about that and venturing out into public prevention again? Anita, I think you have to unmute yourself or turn your volume up. You're muted. Now you're off mute.
Hey, Wanda, I was not trying to say anything here. So my apologies for being unmuted in the first place.
It's okay. I'm just glad you're on the line. Good to see you. Good to see your name.
I am honored to be here.
Thank you. So anybody want to say what things are like in terms of opening up and venturing back out into your prevention activities?
So Wanda, I have my mute button off, and my name is Debbie, and I am from Seminole County, Florida. And I saw there's some other people from Florida too, and South Florida. So we have been on different levels of opening up. Where Central Florida was allowed to start with their phase one sooner than down south. We're still not to where, some of our rest things are open, but as far as meetings and everything, when you talk to groups or we do webinars or Zooms, people are still wanting for the next meeting to be a Zoom or something like that. I know that a lot of the places where we would meet, community centers, they're not quite allowing, and they're not big enough for the social distancing. So, I'm a phone person. My age is back with the dial phone also. This Zoom has been a totally brand new experience for me. It's actually, I kind of like it too, because we can see people, like you said, and still talk. So I'm pretty much just trying, like you say, call people on the phone or have meetings through, the internet system. I don't know about the rest of the states, but with our youth having their schools on internet, it's been a little testy as far as when you get cut off and when you don't get cut off. But the reality is, it is what it is, and so you just do the best that you can.
Mm-hmm. Thank you so much.
You're welcome.
May I add something to the conversation?
Please.
South Florida.
Yes. I know for me, just rebuilding those relationships that may have been lost before the stay-at-home order. Some things might not be in place, or just like maybe relationship with the schools. I know we were on the verge of building some with some schools, and now they're being closed, and we gotta do that all over, that whole process. And then just like you said earlier, being called out on the Zoom calls for being silent, that has been getting me out of that comfort zone and being able to be vocal about what's going on.
Mm-hmm.
Thank you so much, Devin. We appreciate you being vocal on this call too.
Yeah,
I keep saying, we've been sitting in this space for a while, you all, and it's stretching a muscle for all of us. This is new territory for all of us, and I hear you saying that there is anxiety around showing my face and what's happening in the background and speaking, this is what we do in prevention, is communicate.
Yeah.
And we're just being pushed to communicate in a different platform. So I always say, Wanda, she knows me. We're all me. Some of you guys are new to me now today. We are nice, easygoing people. If you want to practice speaking and being on camera, you can do it in this room. I welcome all of you to do it.
I appreciate that.
Yeah,
and then
absolutely.
It's you're finding new ways to, like you said, engage the community. I know on our end, we found ways to get the word out through commercial using Effect TV. So it's been a gift and a curse. So
How's it been a curse?
Because being in this house for so long, that's about it. That's all I can say on that.
Okay. Yeah. And is there somebody else before I make another comment? So I've really learned a lot from our youth. I had no idea about TikTok, right? And so our youth have made these fantastic TikTok videos, and they've gotten their parents involved. So, so we're also helping what's happening in the home because it's really stressful in the homes with parents who have teenagers that, you know, I mean, really, when you think about it, if a child is in after school, right? So if a child is in after school, the child gets up at whatever time of the day now. They go to school, they're in after school, they come home from school, and let's say it's 5:30, 6 o'clock, then they eat dinner, however that happens. They eat dinner. Um, they may go to their separate rooms, and then everybody goes to sleep, and then it starts all over again, and there's really not that much communication. But now there's forced communication, and I will use the term that Devin used. It's a blessing and a curse, because all of a sudden it's like, you know, who are you? Um, and so we can even help with that kind of communication. How much do we want to do parent involvement, parent engagement, parent encouragement? And it's really quite necessary at this time, because parents and children are both grieving, to be honest about it. They're both grieving. The students are grieving time with their friends, graduation, prom, you know, and parents are grieving too, on all levels, because there's so much stress. And if we can introduce some levity, some fun, some happiness into that, then that is a very important role that will not be forgotten after COVID-19 is done.
So Wanda, this is Anita, and you know I never have any answers. I'm just your friend with questions. But as you know, on Monday, we had this virtual town hall about substance use disorder during COVID-19. And one of the things that struck me most was having Dr. Blake Fagan talk about how young people have fewer opportunities to be introduced to illicit substances because of the stay-at-home order. But those who are already on the track will find a way to continue this activity. And it just struck me as you were talking that in some ways the parental connection is even more important and more influential perhaps than usual, because we've disrupted the typical ways that peers, young people and their peers, interact with each other. So how do we equip parents to use this moment where in some ways their adolescents are captive audience, to really talk about these tough issues and to equip their young people with the sort of resiliency that will be necessary once the world opens up again?
Yeah, I think that that is a truly important question. And to kind of pick it apart a little bit, um, one of my favorite sayings is holding young people solely responsible for, you can fill in the blank, underage drinking, whatever it is like holding fish responsible for dying in a polluted stream, which means that it's the adults that surround children that help children to become, as you say, more resilient. But as I've said, it's important for adults, for parents, for grandparents, for caregivers to be helped and be healthy first, so that when they have an interaction with their child, it won't come from a place of hurt and grief and disappointment and being angry with their child for being in the house with them. So, you know, that's to be quite frank about it. And the way that we can do that is by getting these positive messages. First of all, helping parents to identify and know it's okay that they're feeling cabin feverish, that that they're hurting, that they are anxious, angry, and all those things, so that they have the opportunity to recognize that and get help from that. And there's some messaging that we use that can help with that. So that's number one. Number two, when and I have to disagree just a little teeny tiny little bit about there's less access, and maybe you didn't say this, but less access to, well, you didn't say less access, but that young people may be less inclined to use substances during this time when, as a matter of fact, from the teens that we talk to, there's the liquor cabinet. It's not locked. There's beer in the refrigerator. They have access to it, and therefore they may be going down a road that is not suspected. And so young people have actually made messages about the availability of drugs. And so for them, give them a voice, and we'll be surprised as usual about what they'll say. Like, you know, there's my parents' alcohol. I'm feeling really bad. I have friends that drink alcohol. I never did before. Let me give it a try. So in the way that we present this message has to be with prevention in mind, where we think not only about the public health issue, but we think about how the human feels, the human parent, grandparent, caregiver feels, and helping them through that. And then separately, because teenagers do not want to hear from their parents when they're in high school generally, then, you know, helping teenagers understand that this is how they're feeling and their parents are feeling, and then they can come together. And so that's one of the things, or 100 things that I would suggest. And Nicole, I think you're ready to chime in.
Yeah, sure. So, you know, this is a topic, Anita, that you brought up that has come up before. So some of the resources that I'm specifically seeing, there are a few developers of prevention curriculums that have created free resources that are for parents for exactly what you're talking about, which is parents for the first time, or teachers, but they're also like the primary caregiver because their kid is in the house the whole day, or, you know, they're not, you know, but they're home much more than they previously been. So there are a few, and I believe Too Good for Drugs is one of them, but they developed a version of their curriculum that are handouts for parents that assist parents in starting these conversations, having these conversations about resistance skills. So I would say, to your question, one, that's some of it is the role of us as coalition members and folks who are in prevention to provide parents with the resources and the tools to be having these conversations that they haven't been having, right? And the good thing is we do have some prevention developers who are thinking exactly what you're asking, Anita, and saying, hey, what are the resources we can provide to prevention folks that they can then pass on down to parents? And there are things like worksheets and conversations, activities that parents can incorporate around conversations around substance use.
And I would say one other thing, from Search Institute Developmental Assets, they actually have little cards that parents can use to say positive things to their children. Now, that seems like something that one wouldn't have to do, but some people have been so immersed in the activities of work and everything else until we forget, not that I have any children at home, they're grown, but we forget to communicate the good things, and perhaps we're not even comfortable doing that anymore. So these are little cards where you catch your child doing good, and these are all evidence-based. 150 things you can say to enhance the resilience of the children that you come in contact with. So yes, I absolutely agree with Nicole. And then these are some other little conversation starters that you can practice to get back into what it means to communicate with a child in a non-confrontational way.
Hey, Wanda,
Hey,
Yeah,
Wanda.
this is Nancy.
too. Yes.
One of the things that we noticed a while back in our household was that we were forgetting to say thank you.
Mm,
And once we verbalize that and now take the time for just about anything that is being done or thought of or whatever, to just say thank you in some form or fashion has, for lack of a better way to put it, has softened the air in the house.
mhm. Thank you so much. Yes. Thank you. Being grateful. 2 words that can change the atmosphere in the house. That sounds like prevention to me.
That's
Oh, yeah.
Hey, Wanda, this is Philip Graham. I was having some connectivity problems, so I could not clearly hear your question.
Okay. So does anybody remember the question? Yeah, no, so Anita was asking a question. It had to do with substance use among youth, how we help young people who may be in the home with a substance use problem, and then how do we help parents to help their child, whether preventively or while in the midst of being in a house and suffering with that addiction.
Yeah.
So that was one question. And then the other question had to do, well, that was the question. And then we spun off into how we are helping our young people or people in the home in general.
Yeah. So I can answer 2 of the 3 questions. The one on how parents can help young people. We are seeing an increase in the use of telehealth. And I think that gets back to some of the broader conversations. We have pivoted nicely because of the challenge of non-face-to-face interactions. So we are seeing a significant increase in telehealth and in the delivery of services. Even in some of, for example, some of our mentoring work that I do, really now Zoom, WebEx, whatever, changing our content to really focus on how COVID-19 impacts our young people, particularly in terms of how they interact with each other, and also looking for social outlets. The piece that concerns me the most is when kids are in situations where they're in danger. You may have heard that there have been decreases in reported child abuse and neglect cases, but we believe that's because the kids aren't in school and folks aren't identifying them. So on one hand, the data looks good and that, oh, they're going down, but we also recognize that that is in part because teachers, coaches and the like aren't seeing, coalition members aren't seeing our young people and therefore intervening on their behalf. That's going to be one of our big challenges, how we intervene without that level of contact. So even, creating your coalition meetings for youth in Zoom, and maybe there's a way to look for signs. I don't know the answer to that other than it is a clear problem that we need to focus on and figure out how to address.
Mm-hmm. Mm-hmm.
I think there was a third question and I am forgetting. So I've been bouncing back with too many Zoom calls myself. I do encourage folks to look for other avenues for engagement. I also would encourage folks that, a simple conference call without Zoom is still permissible because there is Zoom fatigue is actually a real phenomenon. And that's in part because we over engage having to look at a screen where you might not necessarily own phone. So I would say mix it up too. Going old school is not a bad thing.
Yeah.
Kind of working our own mental health.
Excellent. Thank you so much for your comments. When it comes to trauma, I'm checking the time. Oh, goodness. So when I think about trauma, adverse childhood experiences, and as it pertains to children who are in abusive homes, who are not able to escape. So I have a high ACE score, and one of the things that helps with these teen conversations, so what we start with, and they have activities around, has to do with resilience and what resilience is, what adverse childhood experiences are, and then the young people really take that to their peers. Now, they are certain messages that they can clearly give, so it's not like the whole training about ACEs, but in that way, they can identify what's right and what's wrong behavior for themselves. And then we also, at the end of the meetings, give the text to call if you're having problems. So yeah, I do agree that is really, 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 really important. Nicole, do you think I should go to the next slide?
Yes, we've got about 4 minutes left,
Oh.
so we'll be wrapping up.
Okay. So I think this is the next slide, and this was one of the most popular ads that we constructed. Okay, so so it's okay to laugh. I hope this is a laughing one, otherwise I'll be in trouble. That's it. Can you see that?
What am I looking for in a man? That's hilarious.
So, oh my goodness. And so that is the ad that, I won't say it's gone viral, but I've never received so many likes from anybody and everybody. But so, and it's okay to laugh a little bit. It's okay. I mean, we're not making fun of the virus. We're trying to have a little laughter in the midst of this. But I love the beloved mother part. Okay. And so another one is just simply, did you wash your hands? And so these are just a couple of things and reminders that can start conversations and improve the mood of the many stakeholders in the community. So, Nicole.
Yeah, so we really wanted to thank you all for joining us today on this webinar. We hope that you found the conversation helpful. As you'll see here, our email is here. It's wanda.weeboo@gmail.com. We will send out an email. Thank you all for being on the webinar today so that you have our contact information. We just wanted to offer ourselves as help and assistance as you're thinking about your operating during this current phase and whatever's happening there, but also long term. So we are so happy. This was a great conversation. Thank you all for talking and for being here and for giving us your time. I want to echo what Philip said. We need to have less Zoom calls because there is a lot of research on the fatigue because we're focusing much more than if you were physically sitting in a room. So take breaks, mini breaks, mini breaks.
Naps are great.
Naps are great.
And then I just want to echo the words that Nancy gave us. Thank you so much for joining us. Hope to see you soon. Well,
have a great day, everyone.
Bye.
Bye.